Welcome to the Holistic Feline and Friends podcast, home for all things holistic and healthful for our pets. I'm your host, Angela, also known as the Holistic Feline on Instagram. This season is very special, with the majority of the episodes exposing some sort of huge crack in the pet industry that has misled pet guardians for decades, exposing the truth in a broken system. The intention is to educate and empower pet parents about some of the most dangerous normalized aspects in pet health by bringing truth to light and providing healthy, natural, and holistic alternatives so that our furry loves can live well into their 20s and 30s. Again, I invite you to listen to this season with an open mind, eyes, ears, and hearts. The truth can be harsh or hard to hear at times, but it remains the truth. In this game-changing episode, we continue our conversation with renowned and award-winning integrative veterinarian, Dr. JUDY Morgan. This time, she is explaining the overuse of medication, chemicals, and pesticides in pet health, and how the misuse and overuse of these drugs are wrecking our animals' health. We cover all the common drugs like Apoquel and Gabapentin, antibiotics including Metronidazole, steroids, pain meds, and pathogen pesticides, also known as flea, tick, worm, quote-unquote protection, as well as uncommon drugs and new drugs on the market. Please listen closely. Dr. JUDY provides a plethora of effective, natural, non-toxic, holistic alternatives. Dr. JUDY is noted for her raw honesty, exposing hard truths within the pet industry. She is direct, tell it like it is, there are no limits to what she will bring attention to. She is known as your pet's advocate and enlightens and empowers pet parents on how to be the same. She has won numerous awards, including the 2023 People's Choice Award and the International Association of Top Professionals 2024 Top Holistic Veterinarian of the Decade Award. Dr. JUDY has been featured on ABC, CBS, PBS, CNN, Fox News, and many more. She's a best-selling author of 8 books and host of her own Naturally Healthy Pets podcast. We are absolutely honored to have her join us for a second time this season and lend her voice once again on an important topic, a silent epidemic in pet health many do not speak of. My hope is that this episode enlightens you even more and continues to provide information you did not know, sparking an inspiration within you to make a necessary change to get your pet back on track to true and lasting health and healing. So without further ado, we welcome back the one, the only, Dr. JUDY Morgan. Hello, Dr. JUDY. Welcome back. We are extremely thankful and excited to have you back to talk about another prevalent aspect in pet health. Thank you so much for being with us for part 2.
No problem.
May we begin again with a self-introduction for those who may have missed part 1. Can you please let everyone know who you are and what you do?
I'm a veterinarian with over 40 years experience. I own Dr. JUDY Morgan's Naturally Healthy Pets, which is an e-commerce and educational website with natural health products for dogs, cats, chickens, and horses. And my goal is to educate and empower pet parents so that their pets can live a longer, naturally healthy life.
Beautiful. To give this part 2 context, I will briefly share with everyone again how I have come to find Dr. JUDY. Many years ago, I came across a video where Dr. JUDY was exposing some sort of pet industry flub, and I just remember being so completely taken back by her raw honesty and no-holds-barred delivery. The empowerment she exuded to pet parents was shocking in the best of ways and refreshingly liberating. It's not very often I come across a veterinarian who speaks so honestly and raw about some of the darkest aspects in veterinary care and pet health. And like I said in part 1, she had me at video 1 and I never left her fan club. I refer to her socials, blog, online shop, courses, and website all the time. For myself, as well as clients, friends, and family, she is the absolute best with so many life-saving resources available, so please check her out. As I said in part 1, I appreciate your tenacity, delivering the hard truths within the pet industry. This episode is no different. We're talking the overuse of medications and chemicals that our fur babies have become subject to within standardized pet care. But don't fret, everyone. Dr. JUDY will provide non-toxic, effective, holistic alternatives so that your pet can get on the road to real healing and natural recovery. So let's jump right in. There's so many products that can fit into this overuse category, from flea tick worm meds to pain meds, antibiotics and steroids to the popular gabapentin and Apoquel. Off the top of your head, what are the top 3 overused medications or chemicals you see in pet care?
Number one is probably antibiotics. Overuse of antibiotics is a huge issue because of antibiotic resistance, and that affects not only our pets, but also all the people in the world. So they're widely overused and misused. In the cat world, I think that gabapentin is way overprescribed for sedation for veterinary visits. I don't believe that every cat needs to be completely sedated to have a veterinary visit. And I think there's a lot of better ways that we could train our cats and set them up for success for veterinary visits. And then immune suppressants are also widely overused. So I'm addressing medications. I would say that vaccinations are, I don't count, I mean, technically they're sort of a medication, but vaccinations are also widely overused.
Let's talk in detail about gabapentin. Can you tell us what it's supposed to actually be used for and then how it's overused in pet care?
So it's a human medication, and it can be used for as an anti-seizure medication. It does have sedative effects, and it does have pain-killing effects in the right circumstances. So its pain modulating effects are very specific. It works on nerve roots as they exit the spinal cord. So if we have spinal pain, it can be very effective. If we're just using it for arthritis or general pain relief, it's not very effective and not really a good choice, but it is often used in that manner. For cats in particular, gabapentin is prescribed as a pre-office visit medication because it has more sedative effect in cats than it does in dogs. It'll be a little bit sedating in dogs, but before I became more holistic, I had dogs that lived on gabapentin for years. And I can't say that it made them any calmer or more sedate, but people that take gabapentin say that it's very disorienting. It makes you feel pretty loopy. And unfortunately, because our pets don't have conversations with us, we can't really ask them how they're feeling. And we don't really know, is that making them feel really out of sorts as well? But it's become the norm that veterinarians really want every animal under some sort of sedation when being presented to the vet office. And so gabapentin is what is usually prescribed for cats. Again, I think that we could do a much better job setting our cats up for success for going to a veterinary visit. I think that all cats should be trained to like the carrier. They should be offered treats in the carrier at home. It should be left open in a room where they can go in and out of it at will. It shouldn't be a punishment. It should be, hey, isn't this a wonderful place to be? Here's your favorite catnip toy. Here's your favorite treats that you get to go in there and eat. And if you have, a hard-sided carrier, maybe you actually feed them in there sometimes. And leave the door open and just let them come and go. Put their favorite bed in there so that they can go in there and sleep. We can use all kinds of herbal or CBD or other kinds of more natural products as an anti-anxiety for our cats instead of resorting to something that makes them feel really loopy. So I think we could do a lot better. And I think that it's used as a pain medication incorrectly quite often.
Is there a specific holistic alternative to that?
There's many. There's different herbal preparations that could be used. So sometimes lavender is very calming. Sometimes valerian or skullcap. I mean, there's a lot of different kind of Zen supplements on the market for both cats and dogs. And sometimes you have to experiment around with it. I'm a huge fan of CBD, but sometimes you have to experiment a little to see what works for your animal. So you don't want to wait until you have to take them for that veterinary visit and then go, I'm going to try this new thing that I just got. You should try it at home and see how it affects them. when you don't have to go anywhere, because dosing can be very different. So I was just doing a podcast with somebody from a CBD company, and what we know is that dosing can be very different depending on the anxiety level of the pet. So, you might have a 10-pound dog who needs 20 milligrams of CBD to take the edge off, and you might have a 100-pound dog who only needs 10 milligrams. So it's kind of try it out ahead of time and see what works for your particular animal. And sometimes it can be a combination of things. Melatonin can work, tryptophan can work. There's a lot of different things. My recommendation would be to get a couple of different products, try them on your pet and see what works, see if you need to layer a couple of things. And it also depends how anxious they are, how much relaxation you're going to need to get from them. Like my cats are really chill. They're not afraid of their carriers. So for me to take them to the vet office and have blood drawn or have an exam, they're very mellow about the whole thing. And that's really the goal for all of our pets, is to go and not be traumatized.
I was thinking about CBD, and what are your thoughts on doing that to kind of calm a cat to clip their nails?
It can be effective. Again,
Okay.
You'd have to play with it to see what dose they need. And again, that's something that we should be training our cats to. My cats sit there and I trim their nails. Nobody needs to hold them. Again, a lot of it comes back to how we deal with the animals, what we train them to accept, and get them used to that process. So, and for some of them, yeah, if you've never played with their feet, if you've never trimmed their nails, and they're now a 5-year-old crazed maniac, you're probably going to need a little more CBD or other calming to get them through that. And you don't want to sit and try to do everything in one sitting. You might get one nail done at a time, but you need to make everything a good experience. Our animals are really good at remembering everything bad that happens to them for a very, very, very long time. Good things happen and they're like, that was fun. And, then it's gone. But you really want to work slowly, carefully, and get them used to it and get them to understand that this is not going to be torture every time they touch me.
Yeah. My little one, I don't know. She's a character. So I have a little PSA. I just learned this a few years ago and wanted to share because many of you may not know either. But the majority of meds given to our pets are human meds. They are not meds specifically made for pets. They are human medicine that the dosing has been modified for pet use. So Prozac and Gabapentin, to name a few, but there are so many. It's important to know this, and so important to know the side effects of all medication given to your pets and yourself.
There are things that are made specifically for pets. Some of them, like Rimadyl, was originally made, it's a non-steroidal anti-inflammatory. It was originally supposed to be for people. People have liver failure when given that drug. Should have been a wake-up call, but instead it got repurposed and used as an animal drug. The new Silencia and Librela, the injections for arthritis, again, that drug was originally in trials for use in humans with arthritis. The side effects were so horrible that they stopped the investigation for humans and said, oh, well, maybe we can use it in animals. And so ended up being an animal drug. So there are some drugs that are specifically developed for use in animals. Some of them start as a human medication and there are side effects and problems when they can't go forward with it. So they get repurposed and looked at for animals. But there are some medications that are specifically only in the veterinary world, not in the human world.
So it's important to know this and the side effects of all the medications given to a pet and yourselves for that matter. But just as side effects occur in humans, they also occur in our pets. And so I just want to finish saying that the common side effects in humans for gabapentin, just FYI to know, because this is one that is given to pets as well. It's dizziness, tiredness, swelling of limbs, gait disturbances, which means their manner or style of walking affecting muscles, joints, and nerves, It may cause serious breathing problems, especially in those with pre-existing conditions or those taking other central nervous system depressants. It may cause suicidal thoughts, which I don't think our animals would have. However, it can still affect their mental in some way, shape, or form. It may cause behavioral changes in some individuals, and gabapentin can have additive effects with alcohol, sedatives, and other central nervous system depressants. Stopping it suddenly can cause withdrawal symptoms like insomnia, nausea, pain, and anxiety. So again, it's important to know side effects for every medication or chemical given to your pet and act swiftly with a vet visit if you see signs or symptoms. You mentioned antibiotics, and I know I'm not going to say this right.
Metronidazole.
That's it. I know that one is commonly prescribed for diarrhea.
Yep.
But technically it's not for diarrhea. So can we talk about that and what it's technically used for and how it's misused?
So, metronidazole is an antibiotic, anti-inflammatory, and anti-protozoal. So it's used very commonly for Giardia, which is an intestinal parasite, but it's also prescribed almost any time a pet has diarrhea, particularly if they have bloody diarrhea. And it is not without side effects. So it can have neurologic side effects. One of my dogs paralyzed all four after a dose of metronidazole.
Holy
Luckily, when it
moly.
wore off, she came back to life. But for cats, we can get vision issues. We can get neurologic problems. And I had one dog who developed aplastic anemia after being on metronidazole. So the bone marrow shut down and wouldn't make red blood cells anymore. So we can have all kinds of different side effects. Autoimmune disease, and studies are starting to come out and starting to be printed in the veterinary journals, which is really nice to see, that when we have a diarrhea issue with our pets, giving them a diet that's a little bit higher in fiber, easily digestible sort of bland diet with probiotics will 9 times out of 10 get rid of the diarrhea, and we don't have the long-term side effects that we get when we give an antibiotic for diarrhea. So metronidazole is going to kill any of the bad bacteria that are in the bowel, but they're also going to kill the good bacteria. So we totally disrupt the microbiome and cause what's called dysbiosis, which is an imbalance in the microbes that live in the bowel. Those microbes that live in the bowel are critical for immune system health. They're critical for brain health. They're critical for behavior. So many things that they affect in the body. And when we use metronidazole, we can have changes in that gut microbiome for weeks to months and maybe even years. Whereas if we treat the diarrhea with a bland diet with a little more fiber and probiotics, the microbiome will go back to its normal self very quickly. The diarrhea usually clears up very quickly. We have so many natural ways that we can treat diarrhea at this point. So things like slippery elm, marshmallow root, bentonite clay or montmorillonite clay, very, very effective for almost all diarrhea issues. And certainly if we had a chronic or recurring diarrhea, then I would say we need to look at, does this pet have an inflammatory bowel syndrome? Do we need to look at a different protein for their diet? Do we need to make long-term changes in the diet? I remember one client had gotten a new kitten, and this kitten was literally squirting diarrhea all over their house. Every time this cat moved, diarrhea shot out of this cat. It was not compatible with living a decent life for the people or the cat. And so they had gone to a lot of places, and of course it had been given metronidazole and all kinds of different medications, and nothing had worked. Stool sample was negative for parasites. And I said, I think we need a diet change for this cat. And it was on a chicken-based food. And I said, let's just change to something that's a novel protein. And I if I remember correctly, we put it on a pork-based diet, which is a little bit novel. It's not something that is in all that many foods, but chicken is in a lot of foods.
Right.
And as long as that cat ate its pork-based diet, perfect stools, no diarrhea, no problem at all. And somewhere along, the cat was doing great, growing, gaining weight, no diarrhea. Everybody loved the cat. Somewhere along the way, the cat ended up getting more chicken food. And I don't remember how it happened, but it started all over again. This cat had a true intolerance to chicken.
Oh.
And, but it was an easy fix. I was like, well, you need to, I remember what happened. The pork food that we had been getting, the company stopped making it. And the people were having a really hard time finding another company that made a pork-based diet, and they were complaining about cost. And I was like, well, okay, we can complain about cost. Maybe we have to spend a little more to find find a pork-based diet from another company. But which would you rather have? Diarrhea smearing your walls, your cat losing weight, everybody hating the cat? Or we spend a little more money on food and everybody has a peaceful coexistence. So sometimes it can be that simple. It's like, just change the diet and poof. But there's just a lot of things that we can do to treat that and not use metronidazole. The other thing that metronidazole will get used for sometimes is liver problems, like portal triad disease in cats, which is basically a inflammation of the gallbladder, the liver, and the pancreas. And so commonly metronidazole will be part of the protocol for that. I usually avoided the metronidazole, and we could find other ways around that. But that's kind of the second area where we see it used quite commonly in cats.
And that's a human medicine, right?
Metronidazole is definitely used for people.
Okay.
The other name for it is Flagyl, but it's used quite commonly in people as well.
And is Diagel by Dr. Margot Roman an option?
Yeah.
The Legacy Bio? Okay.
Yeah. Yeah.
And that one's got many ingredients I don't know how to pronounce.
Yeah. Yeah. We used to use Diagel in our practice a lot. It's a paste, so it's easy to give. We would give a dose right in the office and then usually follow up with a couple of days. But that's an easy way to treat and pretty effective. I believe Diagel is only available through veterinarians. So it can, if your vet has never heard of it and doesn't carry it, good luck. But it's a good product.
Okay. That's good to know. I have a PSA about antibiotics. So oftentimes a blanket antibiotic is thrown at an issue. It seems to be everyone's go-to, but in order to have an antibiotic that's effective, it must be an antibiotic for that specific health concern. So a culture needs to be taken and matched with the proper antibiotic. So in my opinion, blanket antibiotic prescribing is dangerous, can be ineffective, and it can wreak havoc on the body with overuse.
A lot of times cats with a cystitis, a bladder inflammation, peeing outside the box, or a bladder obstruction, a lot of times they're put on antibiotics, but when we culture those, they're almost always negative. Cats don't have obstructions or cystitis secondary to infectious causes. It's almost always stress-related, diet-related. So that's another place where antibiotics are definitely overused and not necessary. And a culture is a couple $100. And so very commonly, the veterinarian and the client will say, I don't want to spend the money. Just, pick, your best choice antibiotic for the situation. And if you can say this for dogs, like if you have a dog with all the symptoms of a urinary tract infection and you run a urinalysis and you see bacteria in there and the pH is elevated and it's like, oh yeah, that looks like a bacterial infection. The culture takes 3 to 5 days to get back. And, a lot of times people are like, well, I need to make them comfortable today. I don't want to wait 5 days for the culture to come back. So sometimes you'll kind of pick what you think is the best option. I still recommend running that culture because it may come back in 3 days with, oh, you've got something that's resistant or not sensitive to the antibiotic that you're using. And so you can change quickly instead of running through a 2-week course and then saying, oh, that didn't work, we'll try another one. And that happens so often where it's, oh, we gave an antibiotic, the symptoms didn't get better. Here's a different antibiotic. Oh, the symptoms didn't get better. Let's go for another one. That's how we develop antibiotic resistance. And you're going to end up with an animal with a much bigger problem than what you started with.
Right.
So the culture is always optimal, but it does mean waiting 3 to 5 days to get it back. And, sometimes if you have an animal who's sick enough that you need to get them started on something, you may have to make a best choice. But still following up with that culture is a really, really good idea.
Are there any other antibiotic related things that you would like to mention before we move on?
So for cats, one of the things that they get presented for quite often is sneezing and upper respiratory stuff.
Okay. Yeah.
Almost all of that is viral. Viruses have zero response to antibiotics.
Yes.
So, unless your cat is blowing bright green and yellow thick snot, if it's clear, if they got clear eye discharge, clear nasal discharge, coughing, sneezing, no antibiotics needed.
So a lot of the standard that you always hear is the upper respiratory infection, and that's when the antibiotics are given. They're not needed.
Yeah, most times, particularly in cats, they are not needed.
It's good to know.
They're not going to help. They'll make you feel better because you're doing something.
Right.
That's about it. And let me tell you, I don't like medicating cats. As good as my cats are, I really don't like medicating cats. And if I had the option of not giving an antibiotic to my cat because it didn't need it, I would take that option every day.
Yeah, me too. Okay, let's move to steroids. Steroids is another that I personally see given all the time. They are great in life and death scenarios or emergencies, but in my personal opinion, kind of the same with antibiotics. Throwing them at a health concern to consistently suppress the symptoms rather than find and heal the root cause is detrimental to the pet's health. The original issue continues, sometimes gets worse, and it can potentially cause the pet to develop new health issues. So your thoughts on steroids and the overuse of them?
They used to be overused a lot more, but now we have bigger, better things.
Oh, I don't know if that's a good thing.
Well, no, it's not a good thing.
Okay.
So we have stronger immune suppressants like Apoquel that we use instead. Frankly, I'd rather see steroids used. I think that they're less life-threatening than the newer things that we have. And steroids have their place, but I think they're used in dosages that are too high and they're used for too long. We don't try to get the cats back off it. So a lot of times cats with asthma, they get steroids thrown at them. So in my practice, cats with asthma, one, we put them on a species appropriate high moisture diet because that's part of their problem. Their lungs are too dry. We make sure they're living in a household with clean air. So we're not using air fresheners and candles and potpourri and carpet powders and, cleaning agents with high VOCs. So we want to make sure that we have good air quality in the household. One of the best things you can do for a cat with asthma is sit them next to an open window and let them have fresh air. They need to live in a household where nobody is smoking. So many things that contribute to that. So I would always look at all of those factors and clean up the environment, clean up the diet. And then again, steroids can be very useful for cats with asthma in short bursts. And their asthma tends to be very seasonal. It tends to be worse in winter when the air is very dry. So, something as simple as a nice clean humidifier can be very helpful for these animals. We're doing a lot more with nebulizers and like the AeroCat breathing apparatus, which can be very helpful for these cats. But I actually had one person who had been nebulizing their cat with steroids 3 times a day. The cat lost all of its hair. It had so many side effects. It was a nightmare because, the steroids that the cat is inhaling are being absorbed systemically. So it was causing a problem. But steroids can also be life-saving. So for instance, right now, one of my cats we're trying to figure out how old she is, somewhere between 15 and 18, she started acting really wonky. She's an indoor-only cat, fed exactly the same thing as my other 8 cats. And she just started acting really weird, not using her litter box and acting. She would come out and sit in the middle of the room all hunched over and didn't want to move. I'd actually have to pick her up to get her to move so the dog wouldn't eat her. And then when I would put her in her little cubby that she lives in most of the time, she would fall face first into her food bowl and head press against her food bowl. So I'm like, okay, clearly this is a cat in pain. This is a cat with a headache. I mean, she's just telling me I just want a cool surface against my forehead. So I took her in and had lab work done. And, I did an exam on her. I'm like, all right, your heart sounds great. Your abdomen feels great. Like, everything looks fine. So took her into my vet and she did an exam. She goes, I'm really stumped. I can't find anything wrong with the cat. I said, me either, but look at her behavior. She's so weird. So we did lab work on her. And the only thing that came out weird was her eosinophil count. Eosinophils are a white blood cell that is usually associated with allergies or parasitic infections. Well, she didn't have parasites. So we're like, okay, what is causing this? Ends up, she had an eosinophilic encephalitis, now, which is inflammation of the brain and spinal cord. Where she got this,
Oh my gosh.
no clue. But it was basically showing up as an autoimmune condition attacking her central nervous system.
Oh.
So I'm like, all right, well, sounds like a case for steroids to me. Because steroids are, and one of the things we were taught in vet school is nobody dies without the benefit of steroids. So I was like, well, you know what? I think this is a good case for steroids. And this is why, I don't say never for any medication. So we started her on steroids twice a day, and not a high dose because I don't like to do really high doses. Literally within 48 hours, she was back to acting normal. I'm like, okay, clearly this is what this cat needs. So we left her on that dose for a couple of weeks, and then we went to once a day for a couple of weeks. And then my mother feeds the cat and she eats the medicine, no problem. Yay. So I said, all right, well, let's see how low we can go. And we got her down to twice a week on her half pill of steroids. And within about 2 weeks, she started showing all the same symptoms again, starting being very hunched up, not using the litter box, head pressing in her bowl. And I said, okay, well, clearly twice a week is not enough to maintain whatever, this autoimmune condition that she has. So now she's back on one a day, or a half a pill once a day. Been back on that for about a week, doing really, really well. So the question remains, can we go to every other day? Where is the line that is going to keep this cat comfortable? So there is a time when we say, okay, maybe we need this medication. I mean, this is a lifesaver for her. Without it, she has zero quality of life.
Right.
But what's the lowest dose that we can get away with? She has no side effects, and I don't want side effects. So what's the lowest dose that we can use to solve this problem for this particular cat? So, with any medication, we don't want to say never. It's making blanket statements like never and always will always get you in trouble. So I don't say never, but I say that these medications need to be used very judiciously and in situations where it's sort of you're backed into a corner. Like with my cat, I could put her on other immunosuppressants that would be much stronger and much more life-threatening in my mind. And so this is what happens to be working for her. So, if your veterinarian prescribes steroids, the question to ask is this the only thing that will work? Is this the safest thing that will work? What's the lowest dose we can get the results that we want? And how fast can we get them weaned down on it so that we don't get all those side effects?
So will she have to stay on it for the rest of her life, or is there other options for her?
So far, that's what she's telling me, because when we got her too low, she went right back to the symptoms. So, I mean, this is an extremely rare diagnosis. I never diagnosed eosinophilic encephalitis in 40 years of practice. But of course, veterinarians always get weird cases with their own animals. So she's a very weird case. And we don't know what causes it. She hasn't had vaccinations in 10 years, at least. She eats the same food as my other cats, and she lives inside. So it's not like she's exposed to viruses, bacteria, anything weird. This is just her body said, I want to do this really weird thing. I want to have an autoimmune problem in my brain. And maybe she's got a brain tumor in there. I don't know. I'm not going to put her through an MRI to find out because it wouldn't change my treatment.
That's a really sad.
She's really happy. So it's not so sad because she's doing really well. She's very happy. She's friendly, outgoing, wants attention, loves to be groomed, as long as she's got her steroid on board and keeping the inflammation down in her brain. So, and I don't want her in pain. So, is long-term use of a low dose of steroids going to shorten her life? Maybe, but not treating her certainly is shortening her life
Right.
because she can't live with that level of pain.
Yeah. I think I'm just kind of seeing and feeling how she feels when she's not on the medication. And I'm like, that's really sad to,
It is.
yeah.
But with the medication, she's a happy little camper.
Well,
So
that's good.
she can, and she's a little tiny cat. She's a little 5-pounder, which is really interesting because her litter mate brother was about an 18-pounder.
Oh gosh, that's a difference.
Yeah.
Well, you mentioned Apoquel. I would like to talk about that too, in the terms of its proper use and how it's overused in pet care, and then a natural alternative to that if there is one.
Yes. So Apoquel is a strong immunosuppressant. And the problem with it is that when you suppress the immune system, you open the body up to superinfections and you open the body up to cancer. Because our immune system is scavenging cancer cells. We all have cancer cells in our body all the time. All of our pets do. And the immune system does a really good job of saying, ooh, bad guy, foreign invader, let me kill it. And when we turn off the immune system, there's nobody watching over that anymore. So we know after Apoquel being on the market for many years that we see a lot more cancers in animals who are chronically on it. Apoquel is misused in that any animal with allergies, scratching, any kind of itching type symptoms, it's like, oh, we'll put them on Apoquel. Well, if your cat happens to have fleas and a flea allergy, suppressing the immune system and suppressing the itch response isn't solving the problem. We need to get rid of the fleas. If they have an allergy to food or an allergy to something in their environment, all Apoquel is doing is suppressing symptoms. It's not treating the underlying problem. And it should never be used long term. And that's one of the problems with it is, it gets prescribed for your animal and then they just stay on it forever. And it's really not meant to be used that way. And I think that's a very inappropriate way to use it. I didn't even have Apoquel in my practice. I wouldn't use it. I think it's a dangerous medication and we should not be using it. And we should be looking for what we really want is ways to modulate the immune system. We want to strengthen the immune system to react in an appropriate way and not just turn it off. So great immune modulators are adaptogens. And adaptogens are plants or herbs that adapt the immune system to the environment how you want it to work. So it can either turn it on or turn it off. And it's a great thing about plant medicine. It kind of knows what to do. And you're not playing God by saying, I'm turning off the immune system. It's like, hey, why don't you jump in there and give it some direction? So great adaptogens, mushrooms. I think all of our animals should get mushrooms all the time. And there are different medicinal mushrooms depending on, what part of the body we're trying to affect, or, do we need to build blood? Like cordyceps would be a great one for all these asthmatic cats. It builds blood, drives oxygen into the blood. I mean, it's just... and that's kind of what we need for moistening and supporting lung function. Cordyceps is also really good for kidney support. So if you've got a cat with any kind of kidney issues, cordyceps would be a great mushroom to add. So we've got all the different mushrooms, reishi, maitake, turkey tail, lion's mane, cordyceps. So a lot of different ones that can be really beneficial for immune system support. Colostrum is another really good immune system support. And those are things that cats don't mind taking. Some of the mushrooms can be a little bitter, but the tinctures tend to make them a little more palatable, depending on how they're made. And sometimes using a mushroom blend can be a little better. But we also have mushroom powders, mushroom chews. There's a bunch of different ways you can get it into them. Colostrum, they tend to like. So you can use goat colostrum, cow colostrum, whatever you can access. So we want to be looking at how do we support the immune system, not kill it.
Yeah. So I have, again, some PSAs on Apoquel. Apoquel is only FDA approved for use in dogs only that are 12 months of age or older. Some dogs may experience vomiting, diarrhea, or a slightly higher risk of infections like bladder infections. It should never be used on a dog with serious infections or cancer. While sometimes used off-label by veterinarians for cats, it is not approved for use in cats. And I personally do not recommend it, and it should not be used in cats. It's my opinion. The chewable form is dangerous and deadly to cats, especially the new pork-flavored chewable tablets being highly palatable to cats. They can cause acute kidney failure if ingested. And so if the veterinarian thinks or is saying that it's a food sensitivity or intolerance that is causing the itch, my motto is change the food, seize the itch. Throw out the Apoquel, and let's get to the bottom of it. Let's move on to flea, tick, and worm medication. In my awareness, they're not preventing a bite or a worm infection from entering the body. So what are your thoughts on these?
Almost all of those chemicals do not repel. They only kill the fleas or ticks after they get on your pet and bite them. They're all neurotoxins, all the chemicals, whether it's ingested or topical, cause behavior issues, cause autoimmune disease, cause vomiting, diarrhea, pick a problem. Way too many problems with these. We've had just hundreds of thousands of reports of toxicities and side effects. And I don't think they should be used. They don't prevent tick-borne diseases because the ticks have to bite your animal. And the other problem, well, there's a couple problems. So there's a study that just came out that when we give the oral flea and tick pesticides, the metabolites of that are passed in the stool. And so let's say your cat goes outside or your dog goes outside, the stool has the metabolites in it. And then when dung beetles and other insects go in to break down that stool, it kills them because there's a pesticide in the stool. So we are killing off beneficial bugs in our environment. We also know from reports in Europe, fipronil, which is in Frontline and a bunch of other topicals, is found in all the waterways in Europe. It was also found in the hair of children in France, whether the people had dogs and cats or not. And it's because it's in the water. We are polluting our environment by using all these chemicals. So that's really not a good thing. Indoor cats don't have exposure to fleas and ticks. Why would we? And actually the Veterinary Parasite Association recommends that every pet, every month, all year long, be treated with some sort of a chemical pesticide.
Gosh.
No matter what environment they live in, no matter what their exposure is, that is crazy.
Right.
That is basically just selling chemicals for big pharma.
Right.
The other problem is that, let's say you do have a flea infestation in your house or on your pet. The life cycle of the flea, only 5% of the life cycle is on your pet. The other 95% of the life cycle is in the environment. We get really crazy throwing chemicals and bathing and spraying and dipping our pets, and we don't do anything with the environment. So 95% of the life cycle we're ignoring, and then we're killing our pets with chemicals for that 5% that we're seeing. So it's really critical if you have a problem, you've got to treat the environment. So very commonly, more so when I was in New Jersey, because in the South, most people are on a slab for their foundation. They don't have crawl spaces and they don't have basements in the South. But in New Jersey, everybody had a crawl space or a basement, and that area was often neglected. And that's where the fleas keep reproducing and reproducing. Our yard, that's a place where fleas and ticks are reproducing. So beneficial nematodes sprayed on your yard can do wonders for breaking the life cycle. I have a lot of clients in Florida that they could not break the life cycle because it doesn't freeze down there. Once they started using the beneficial nematodes on their lawn, poof, the problem is now gone and they're not having to treat all the time. So we have 7 cats who live outside. There are barn cats. They catch mice, they catch grasshoppers, they live the best cat life ever. They're more prone to pick up parasites because they're outside and they're playing with mice and bunnies and other critters, squirrels that have fleas. So interestingly, when our cats go down in the woods, they should be coming back with ticks, and they rarely come back with ticks. It's not that we don't have ticks in our woods. It's that our cats are very healthy and they don't taste good to the ticks. So they're like, parasites parasitize the weak. And so if your pet's immune system is strong, they're going to have less parasite problems. So I used to have clients with multiple cats. One client had 12 indoor cats. Actually, I had one client with 60 indoor cats. And they would bring all the cats in, and you'd have this old, skinny, rickety kidney failure cat that would be covered in fleas. And then you have the young, robust, healthy cats with beautiful coats and no fleas. They're living in the same exact household. They're both exposed to the same number of fleas, but the fleas go for the weak. That's what a parasite does. It goes for the weak. So again, keeping that immune system really healthy is what will keep them from being heavily parasitized. So of our 7 outdoor cats, if I find 1 or 2 ticks a year on them, that's a lot. They don't taste good. So the ticks really don't bother them. We do find fleas on them in usually the fall is when it's the worst. And so our way of treating them, they're outdoor cats. They can't wear a collar. So I can't put like an ultrasonic or scalar wave tag on them, which I use on my dogs. And I'm not going to use chemicals on them. So we have a natural powder that has yarrow and neem and diatomaceous earth. And it only takes about a half a teaspoon of that to treat a cat. So for the barn cats, the easiest thing to do with them is we shake a little powder into the palm of our hand and pet the kitty. And that petting the kitty once a week with a little bit of powder works really well. So for me, doing something, and I can't treat 23 acres that they're hanging out on with beneficial nematodes. So I treat the yard up near the house, but I can't treat the whole farm. So they're going to have exposure, but we have one cat who is one of the older ones outside who has a flea allergy. So we'll get a couple little bald patches on her. But for the most part, because they're very healthy and their immune systems are really good, they don't get infested. So that's what we need to look for. But we need to be treating the environment, and then we need to look at natural ways to treat the cats. So there are cat-safe essential oil, shampoos, soaps, sprays, powders, so many different ways that we can treat them without resorting to the chemicals and the neurotoxins. And people listening, maybe they have used some of these powerful neurotoxins, either topically or orally for their cats. And they're saying, well, I've never had a problem. Well, you don't have a problem that you're seeing, but I can tell you it is a neurotoxin. It is scrambling their brain. It causes behavior issues. We know that. It also has to be detoxed by the liver. So it is taxing their liver with every dose. And so we need to be supporting and detoxifying their livers if we've got them on these chemicals.
Yeah, I think for me, it was several years ago now when I had this connection of dots. And so I'll mention it here. I know we talk a lot about the chemicals of the fleas and ticks, but I didn't realize that it's like an insecticide, like a pesticide. So like same kind of things that we're spraying on our fruits and vegetables, and everyone's saying that it's causing all these health problems in humans, and to avoid GMO, get organic. It's the same thing.
Yep.
And we're now giving them and putting it on our pets, and sometimes giving it to them monthly. So if we're saying, if everyone is saying don't do it for the humans because it's causing A, B, and C, and get organic, then connect those dots. We shouldn't be giving it orally or topically on our pets either, because it's the same type of chemical. So I share that because it took, I don't know, I think it was maybe several years ago now that I connected those dots. And I think that a lot of things in pet health, you know something in human health and you know something in pet health, but you don't really connect the dots and they intertwine. And that connected for me, and I had an aha moment. So I wanted to share that.
Yeah, I had an aha moment years ago because this was when I was just started getting into doing things a little more holistically. I was at my mother's house and she said, hey, when you come home from the office and you stop over next time, bring me more of the topical flea and tick product. I'm out. And she had one dog. And for some reason, I asked her, hey, have you ever seen a flea or a tick on your dog? And she said, no, and I don't want to. And I had this light bulb moment where I was like, oh my gosh, she thinks this repels. She thinks she's not seeing fleas or ticks because she's putting this product on every month.
Right.
The reality is she's not seeing fleas and ticks because she doesn't have fleas or ticks in her environment. And this stuff is just putting poison on her dog for no reason because she doesn't live in a yard with fleas and ticks. So that was my light bulb moment. I've had a lot of light bulb moments when my mother says things that I go, oh, wait a minute. But it's great because she's sort of the typical client. Like, this is how clients think. Like, I've been putting this on every single month because I don't want to see fleas and ticks. And it's like, well, you're not seeing them because they're not in your environment. It's not because you're putting that chemical on.
Yeah, it's important that everybody knows that those chemicals aren't prevention. It does not prevent them from still getting on your pet, still biting your pet. So we want to work towards prevention, but in natural ways that you covered, and boosting the immunity and providing a species-appropriate fresh food diet. The first FDA-approved long-acting, 12 months to be exact, drug by injection made by Bravecto Quantum. Wanted to see if you have any thoughts on that, because the side effects are muscle tremors, seizures, and it contains a certain compound known to cause adverse neurological reactions in some dogs. And there's also the 4-in-1, the Credelio Quattro.
Oh, that's here.
What are your thoughts on those two?
Yeah, those are bad. They're neurotoxins. They are in the isoxazoline class. And like I said, we've had hundreds of thousands of reports of seizures, tremors, neurologic symptoms, and death, by the way. We did something called Project Jake. It was a survey of pet owners who had used any kind of pesticide on their dogs and cats. And 2/3 of the people that had used any kind of pesticide reported reactions. 2/3.
Right.
That's a lot. And, you don't want to join in that, because these animals that start having seizures, people go, oh, well, the drug it wears off in 3 months. So they, look on their calendar and they mark off the day that the drug will be out of the system. So they think, and they go, and the seizures will disappear then. No, those seizures are for life. We have scrambled their brain for life. You're going to have seizures forever. They're going to be on anti-seizure medication. Doesn't control them very well. You're still going to have issues. If you go through a very, very good detox, we had one little dog in Belgium, 8 weeks old, given NexGard, started having seizures. He ended up on 5 different anti-seizure medications. And the owner was so diligent and worked up a really good detox protocol. And the dog was on the detox protocol for over a year. And I think he's down to 1 or 2 seizure medications now. But he's not seizure-free, and he can't survive without the medications. And that was from 1 dose of neurotoxic flea and tick chemical.
I mean, this stuff is so preventable, and that's what's so incredibly sad and heartbreaking about it.
Well, and something like the Bravecto Quantum, it's an injection that lasts for 12 months. Well, we've actually looked at these, and the injection stays there much longer. Like, we've had people that have given 1 dose of Bravecto to their dog, and it lasts 3 months. A year later, they're still finding dead ticks. Like, ticks attach and they're still dying a year later. So the chemical is still there. It's in a much lower quantity, but it's still there. It's not like it miraculously disappears on day 90, or in the case of Bravecto Quantum, miraculously disappears in 1 year. And by the way, when you inject something, you can't get it back out. If they have a bad reaction to it, you cannot remove it once it's in the body, and there is no antidote. There is nothing you can do. You can detox their system. You can use MCT oil to try to help bind up some of it, but it's there. You can't get it back out. I think that this Bravecto Quantum, any veterinarian who's using that is guilty of malpractice, because it is so dangerous. But it somehow passed FDA. But frankly, if you pay enough money to the FDA, you can get anything through. And that's what we've seen. And for most drugs that are released onto the market and approved or conditionally approved by FDA, they're tested in a very small number of pets, very small. And usually they're animals in a laboratory setting under a very closed environment. And it's not tested on animals who may have, a dozen different comorbidities or problems, different ages, different medications that they might be on. So the real guinea pigs, anytime a drug comes out, are the first 100,000 animals that the drug is used on. So when something new comes out, don't be the first one in line and say, oh, that sounds great. Be the last one in line. Like when a drug rep would come in my office and say, oh, we've got this new drug and it does blah, 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 and there's no side effects. First of all, you can't say there's no side effects because there's side effects to water if you drink too much of it. I would say to them, come back to me in 5 years. When I see what this drug has done to all of our pets for 5 years, then I'll decide whether it's something I will allow. And I think we should all be that cautious. And I think our veterinarians should be that cautious.
Yeah.
But there's, we got to have 100,000 animals try something. And then the problem is once something is approved by FDA, getting it taken back off, almost impossible. We had a conversation after we did the Project Jake survey. We had a conversation with FDA. I was shocked that they gave us an hour of their time. And at the end of our meeting where we were reporting all of the results, we said, what are you going to do about this? We think that this drug should be pulled. And they said, there haven't been enough reports.
Oh, gosh.
Not enough deaths. Not enough side effects. I'm like, really? You've got a few 100,000. What is enough?
That's disgusting. I mean, one death of a loved one is too much for me.
Well, that's kind of my feeling. But yeah, it's very, so for instance, this is not used in cats, but ProHeart, which is moxidectin injectable, it's for heartworm prevention. And it came out as ProHeart 6, maybe 12 years ago, as an injection. It would last 6 months. And, everybody jumped on the bandwagon. And so many dogs died that they actually pulled it off the market. FDA made them pull it, which was shocking because nothing ever gets pulled. The bad news is that a few years later, ProHeart 6 came back on the market with absolutely zero changes in the formulation or the drug content of the injection. The only change was that the veterinarians had a handout that the drug company made, of course, that was supposed to be given to the pet owner saying, here are the possible side effects, liver failure, death, blah, blah. And so the clients were supposed to be able to make a more informed decision based on being given that handout. Well, I've never talked to a pet owner who has been given that handout. So that's problem number one.
Or would read it, probably.
So they didn't change the formulation. It's not killing less dogs. It's still a problem. And the marketing on that went so well, and clients like it because it's like, oh, I don't have to worry about giving a pill once a month. Like that's so difficult. So they came out with ProHeart 12, which is the same exact thing with 3 times the concentration of moxidectin. Now, moxidectin is another neurotoxin. It causes seizures, tremors, death, blah, blah. Now we have ProHeart 12, 3 times the dose, and it lasts for 12 months. And clients are like, woohoo, best thing ever. 1 shot a year. Don't have to worry about heartworms. Yes, and you put it in and they have a side effect and you can't get it out and there's no antidote. Why would we do that?
That's scary.
So that is how money talks to the FDA.
Right. Yeah. I mean, I compare it again when you connect the human experience to the animal experience. Injecting the animals and giving it orally is parallel to us humans taking something orally or injecting it in ourselves to what we think is preventing something, but it's not preventing anything. Mm-hmm. I can't imagine anyone going and swallowing a whole glass full of antifreeze, because it's a chemical that can kill you as well, or a pesticide.
I can't imagine. Yeah. Swallowing a pesticide. Right. Like, why would I want to do that?
Like, if you were to ask a human to do that, I would hope the human would be like, what? Is that going to kill me? But we're doing that to our animals.
So this was floated around when Bravecto and the isoxazoline drugs first came out. They were talking about, so the drug is Florilanor. Florilanor is approved for chickens. It's called Exult, and it's used, it started in Europe and now it's been approved here. It is put in the water of chickens in chicken houses on poultry farms. And it's to control poultry mites, because when birds have mites, they spend a lot of time scratching, and they're not growing as rapidly. They're not laying as many eggs. And so we are all now eating chicken where the chickens have been fed Florilanor, and there's no withdrawal time that it has to be taken away. We don't know how it affects us when it's in the meat or in the eggs, what the metabolites do, how long they stay. That's a huge problem. And then they were floating around about 10 years ago. Hey, in countries where malaria is a really big problem, if 25% of the humans were given Florilanor, it would kill the mosquitoes when the mosquitoes bite them. We would kill off enough of the mosquito population that we could stop the spread of malaria. Now, first of all, I don't want to be part of the 25% of the population that they do this to, but it's going to be third world countries. So, nobody's going to explain to people like, hey, this is a neurotoxin. It might be a problem. And the other problem is that if we wipe out the mosquito population, what about the birds, the frogs, the lizards, all the animals that eat mosquitoes? Like, why are we so egotistical that we think we can wipe out one part of the food chain and it not having an effect?
Right.
So when we say, I can't imagine, people willingly eating this, well, we are.
Gosh. There might be a bigger problem in this world than I think.
Uh-huh.
I think the moral of the story is to stay away from the chemical-based flea, tick, worms. There's natural things you can do, and really, really stay away from the long-acting and the 4-in-1s and the 3-in-1s. And It's just dangerous, dangerous, dangerous.
Yep.
Okay, so let's talk about pain meds. And I have an example here. I noticed for anesthesia dentals, it's a laundry list of meds from antibiotics and pain meds to pre-sedation and, of course, the anesthesia meds. The long-acting antibiotics and pain meds seem to be very popular.
Well, especially for cats, because if I can give an injection of antibiotics that's going to last for 2 weeks, it means the owner doesn't have to shove something down their mouth twice a day, every day, which most owners are very happy with.
Yeah, I mean, those long-acting medications are definitely created for the humans, not for the pets, but some in the list are needed and some only depend on the procedure, yet the dependent ones are still included in standard procedure. So what are your thoughts on the array of medication used before, during, and after anesthesia dentals, and then the overuse of pain meds in general?
Well, I don't know that we can say overuse of pain meds so much. I mean, sometimes they're used for too long, but for years and years, we did not give our animals enough pain meds around surgery or painful procedures. And because animals can't talk, and because we didn't have many options 40 years ago, I think that we were not good at controlling pain, particularly post-surgical, that sort of thing. We do know that it is much better to preempt pain than it is to try to treat it after it is already ramped up. And the same with like anxiety, fear. If we preempt it before, like, if you're bringing your animal in to spend the day at the hospital, they're going to be freaked out. They're going to be scared. They're going to be anxious. If they're given something right at the time that they're admitted to take the edge off, they're going to have a much better time while they're there. And again, once they ramp up, it's very hard to bring them back down, and it takes a lot more drugs, a lot higher doses to kill pain that is already ramped up. We also know that if you use a combination of things, so a very low dose of 2 or 3 different things can give you a better effect and allow you to use lower doses of medications. So a lot of times when you see a lot of injections on there and a lot of different things, it's because we know that that combination is going to be more effective than any one of those by itself. And we're able to use lower doses of each one of them than if we were to use just one individually. So we get less side effects in the long run. And that's very difficult for the layperson to look at this laundry list, like, okay, my cat's going in for a dental. Why are they giving 6 injections? The antibiotic injection is definitely not needed. We do know that there's a great study that even in animals going in with horribly dirty, infected mouths, they did blood cultures on these animals before, during, and after, like an hour after the dental procedure, even if there were a bunch of extractions and deep pockets and disgusting mouths. And what they found is that their blood cultures were negative going into surgery. Their blood cultures were positive during the procedure when they were extracting the teeth and, in their cleaning, and the blood supply was being exposed to all those bacteria and, everything really rattling around. And then an hour later, the blood cultures were negative again after the procedure, even without antibiotics. So that's the immune system doing what it's supposed to do. It's like, all these bacteria just jumped into the bloodstream. We better jump in there and take care of it. And so we know that works. And so antibiotics for something like that, we now know are not necessary. Now, if I had an animal with, mitral valve disease, some significant heart disease, maybe if I had an animal with significant kidney disease, we might have to address that situation a little bit differently for an individual animal. But this is another area where antibiotics are often overused and don't need to be. Cat abscesses. That's another place where definite overuse of antibiotics. My barn cats, they get in scuffles once in a while with each other and with other animals. Every single one of their abscesses, it's opened and drained on its own. It's been cleaned up on its own, and no antibiotics necessary. They do really well because their immune system says, I need to fix that. This is, again, an area where antibiotics are overused. So I can't fault pain medications too much. There are natural things we can use, like DGP, which is doggone pain, can be used in cats as well. One of my dogs was having some back pain, and I didn't want to give him a steroid or a non-steroidal. So I said, doggone pain, I'll give him that, 2-3 doses. He was like, no, I feel great. Every time my cats go in for a dental or anything at the vet, they get sent home with Onsior, which is a non-steroidal anti-inflammatory approved for cats. I've never given it. Mm-hmm. Like, I think I'll, I take it home. I'm like, well, just in case, like if they seem really miserable, I'll have it on hand. But the only time I gave it, I tried it on my cat that's on the steroids. I gave her a dose of Onsior because I had it. And I was like, well, let's see if that makes her not painful because she was so hunched up and miserable. It helped a little bit, but it was nothing compared to what the steroid did for her. So I'm like, okay, you need your immune system realigned. And so I forgot to mention with her, she's on the steroids, but she's also on some natural inflammation modulators and immune modulators. And so we're hoping that with time, all that stuff can kind of build up and flatten things out, and we'll need less of the steroid. So that's kind of the goal. So I get people who email me, they'll get an estimate for their animal to go in for a procedure, and they'll send me the estimate and go, do I really need all this stuff? And most of it usually is necessary, but there are times when I'll look at it and go, yeah, I would probably decline this, and I would decline this, and I would ask for this instead of this. But, anesthetic protocols can be modified depending, and this is why it's so important if your animal's going in for a procedure, get lab work done ahead of time, because the anesthetic protocol can be modified. If they have kidney values that are elevated, it's like, well, then I want to use drugs that are processed through the liver, not the kidneys. If their liver enzymes are elevated, well, then I want to use drugs that are processed through the kidneys and not through the liver. So we can modify things based on the individual animal. So, we're not looking for that one-size-fits-all protocol.
Before I tell you my story, can you mention the natural immune modulators that you're using?
So mushrooms, again, colostrum, and then PEA is my big one that I'm using with her.
And that one is good for, is it pain and joint?
So PEA works on mast cells and glial cells, which are, the glial cells actually support the cells of the nervous system. And PEA is palmitoyl ethanolamide. It's actually made in our bodies, in our animals' bodies, but we don't make it as well as we age. And sometimes we just don't make enough of it. So it can be very helpful for joint support, for immune system support. We've used it for a lot of different scenarios, and it's pretty cool stuff. Actually, my horses take it, my family takes it, my dogs take it, my cat takes it.
I know of it because of you. I saw it on,
It's cool
I
stuff.
think, Instagram or newsletter, but I was like, that
It's
seems,
cool stuff.
yeah, pretty magical.
It's been pretty magical. We're pretty happy with it, and it's tasteless. So like my cat eats that with no problem. She's like, no big deal.
Maybe I should take it too.
We do.
So I will share my little story here about Millie. She is our little one who had her first dental cleaning at 2 years old. It was an anesthesia dental cleaning. And before the appointment date, they gave us an estimate of the cost, which our estimate included all the meds given during the procedure. And so I personally went through every single med listed and looked it up to see what it's used for. I opted out of the ones not needed. For instance, she doesn't need an antibiotic if there's no reason for it.
Right.
So if it's just a standard cleaning, I opt out of the antibiotics and pain meds. But if one of those are needed, I opt for the oral take-home rather than the long-acting one indicated on the list that is standard to give. So this way I can control the intake, the hours it lasts, and seize them if there's a reaction or no longer needed.
Yep.
So in this particular cleaning, no other procedure was performed other than the cleaning. So those particular meds were omitted altogether. I'm now learning the antibiotics are not needed. So I will move forward accordingly with that new knowledge. But it is important to find a vet who will partner with you in your pet's care, listen and honor your wishes, and also educate you on different scenarios that may occur in which a med would be given if applicable. We both came to the agreement on what I permit. They agreed to it. It worked beautifully in my experience. And I know for me, I want to be fully and thoroughly informed what she'll be receiving and why, so I can decide which ones out of the list she gets for the function of the cleaning and when applicable. And just a little side note, a little tip, a few weeks before the cleaning, I begin to add Adored Beast Apothecary's liver tonic to her food as directed on the back of the bottle, and will continue until the bottle is complete. And this helps her body and organs prepare for the anesthesia and the influx of meds, and also helps her to process and eliminate them after the procedure for a quicker, healthier recovery. So that is my story.
Yeah, we actually, in my dental blog on the website, there is a detox protocol for any anesthetic procedure.
Perfect. I'll have that linked in our pod blog for this episode so everyone can go read that. Okay, so are there any additional meds, chemicals, or pesticides that you would like to mention, or anything else in general that you would like to mention that is overused?
We have a whole series, I think it's on YouTube, of spooky drugs, and I think there's like 10 or 12 of them because we did that one year in the fall for the month of October. We did spooky drugs.
I do remember that, yeah.
So that would be a good place to look. It's easier to find on YouTube than it is on the other social media sites.
Okay, we'll have that linked too in our pod blog for easy access. What advice would you give a pet parent who has been prescribed the aforementioned products that we've been talking about? Or even, let's say, new products that may surface in the future, because we know new drugs are constantly surfacing.
They are. So the thing that is so often overlooked, when you go to the pharmacy to get a medication for yourself, you are also handed about 5 pages of these are the side effects, these are the drug interactions, this is, don't take if you have blah, blah, blah. We don't get that in veterinary medicine. So my advice is anytime you take your pet to the veterinarian, if they want to prescribe something, ask what the side effects could be so that if you do take the drug, you know what to watch for. If you go home with a non-steroidal anti-inflammatory, you need to know to watch for vomiting, diarrhea, blood in the stool. If you go home with a steroid, you need to know that they are going to drink and urinate more than usual. So whatever the medication is, you need to know what the potential side effects are so that you can be on the lookout. And if you see that side effect, you can, call them up and say, hey, do I need to stop this drug or not? Sometimes you'll ask, are there any side effects? And the answer is, oh, no, we never see any side effects. That's not a true answer. Maybe they're not seeing side effects, but side effects are documented and are a possibility. Every vet clinic should have a book called a PDR, which is a physician's desk reference. And it lists every drug and, it gives you all the chemical interactions and how it works and what it looks like. But it also tells you the side effects that have been documented. I've had clients say, I want to see the PDR on that. I'm like, okay, fine. Open it up. Let you read it. Not many clients, but a well-educated client will do that sometimes. But the other good news is that every one of us walks around, well, pretty much everyone, walks around with a little mini computer in our pocket. Mm-hmm. You can whip out your phone and you can type into your search engine side effects of Clavimox, side effects of Apoquel, and it'll bring them up. And you can read through them and go, oh, this is a little concerning. And then you can ask the question, is this going to be a problem? How often do you see this? I'm concerned about this. Is there an alternative that might be better, safer, easier? So you should always ask questions and you want to know. And if your pet is on any other medications, and particularly if you're standing in an emergency service or it's not your regular veterinarian that you're seeing, you want to know what your pet is already on. And then you want to say, well, he's on this, this, and this. Is this going to interact badly with this new thing that you're saying I need to add on? We need to know all that. We don't ask those questions often enough, and we don't look up the side effects. And this is not just a veterinary problem. My mother was in the hospital. We went through a really bad run a few years ago, and she was in the ER, and I had admitted her at midnight. And at 5:00 in the morning, a nurse came in to hang 3 bags on my mom's IV pole. And I said, what are those? And she said, these are the 3 antibiotics the doctor prescribed for her. I said, what doctor? We haven't even seen a doctor. We had not even seen a doctor, but some doctor somewhere in the halls of the hospital had prescribed 3 antibiotics for a patient she had never even looked at. And I chased the nurse out of the room and said, no, you will not. And I want to talk to a doctor before we hang anything on here. So the doctor, she was a resident. She came in and she was a GI resident. And I said, I understand you want to hang 3 antibiotics on my mom's pole and you haven't even examined her yet. Well, I read her history. I read her record. So this is the standard protocol for this. And I said, standard protocol for a patient you haven't examined. And I said, can you tell me the side effects of these 3 antibiotics? And she's like, not off the top of my head. I said, funny thing, I can, because I happen to know the side effects of the 3 antibiotics. And she got really mad at me. And I said, if you can't even tell me the side effects, you can't prescribe it. And I made her whip out her phone and read me the side effects of all 3 of the antibiotics. And when she finished reading them to me, I looked at her. My mom was 84 at the time. And I said, would you give that to your 84-year-old mother? And she went, ooh, I don't know. Ooh. And I said, these are the kind of things that maybe you should consider. And I know you're having a really busy night in the ER, but this is not happening on my watch, and that's why I'm here. So believe it or not, of the 3, I agreed to Metronidazole of all the things because it has a great anti-inflammatory effect. And my mother had ulceration of the bowel, and the Metronidazole was actually going to be a good choice for that. And I knew what the side effect potential was. And it worked beautifully. Within 24 hours, my mom was much better. And, it was a great thing. But if I had let them hang all 3, the chances of her having C. diff and having a much more serious problem were pretty high. So this is not just a veterinary medicine problem. This is an across-the-board problem. And this is why it's so important to me that pet parents are well-informed and educated and empowered to ask questions, stand up for what is right, and really just be educated so that you're able to do that. And so if you have family members who need to go in the hospital, or if you need to go in the hospital, make sure you have an advocate that is going to be the voice that you may not be able to be at that time. And then you need to be that advocate for your pets because they certainly can't speak. And it's up to us to be the educated pet parent who says, hold on one second. let me do a little research on this. Give me 3 minutes, because you can find out that fast on your phone and then make an informed decision. It's really important.
Yeah. And I agree and reiterate that to the 500th power. It is so important. I had a similar experience. It was last year. My mom got in a car accident. She had so many broken bones, but she was in the hospital for a week and then rehab for about a month and a half. And by the time I got there, I think it was like her second day in the hospital. And we were there with her 24/7, and we slept there. We documented everything that was given. And anytime somebody came in there, I was like, what is this? What is that? Why does she need it? How much are you giving? Like, they thought I was grilling them. And there were times where I was like, okay, what is this for? And I don't think she needs this. And let's really look into it. And I know I'm probably an annoyance to them because, like you said, they have 100 things going on.
Yep.
But I said the same thing to my mom. I was like, I am here to be your voice and your advocate, and I will fight for you until the end. And I'm not going to allow them to just come in here and give whatever they want because it's standard protocol. And like, her diabetic medication was not correct for like the entire time she was in the hospital and the rehab, even though she kept saying it. I'm looking back in retrospect and I'm like, she could have died from the wrong diabetic medicine given. And so it is very important to have somebody there as your advocate for humans and pets, for you to question, for you to look up, for you to be their voice, because it is a thing. It's prevalent in pet and human health. So
exactly.
Yeah. Okay, so where does fresh food, we talked about this a little bit on some of the things, but where does fresh food, species appropriate nutrition fall into all of this overuse? Can feeding a fresh food, species appropriate diet assist in healing the root cause while seizing and reversing the symptoms we're seeing? Like, for instance, the itch we see associated with food or environmental sensitivities and intolerances. In that particular instance, conventional solution is typically throwing Apoquel at it and accompanied with prescription diets, which we talked about in part 1. So what are your thoughts? Where does fresh food and species appropriate nutrition fall with the overuse of things?
You can't out-supplement a bad diet, and you can't build a house without a good foundation, and food is the foundation. So when a new client would come to me with their pet with whatever problem it had, the first thing we address is food. And even if they say, no, we have no problems with the food, the microbiome is the immune system, and we need a healthy microbiome. And unfortunately, in veterinary medicine and in human medicine, we spend way too much time killing the microbiome with drugs, with bad food, stress, age, so many things. So we always start with food. And once we get the diet going in a better direction, a lot of times the amount of medication needed drops way off. If diet itself is not enough to solve the issue, then a lot of times we'll go to herbs. Herbs are basically a concentrated form of food. And so we can add that in as our next step. The drugs take a back seat to the foundational medicine, which is going to be the diet.
Yeah, I always say diet starts and ends with diet. In your opinion, can all of these meds and chemicals and insecticides be replaced with natural, non-toxic alternatives?
Yep.
Yay. It's wonderful to hear. Let's say that again. Yes, they can. In case anyone missed part 1, I want to share with you again all the amazing resources and things Dr. Judy offers, because it's so important to educate ourselves, and all her resources are phenomenal. She has an amazing educational resource offering courses on an array of topics at Dr. Judy U. I highly recommend you all utilize this and empower yourselves, along with her blog that is incredibly informative and vast in topics. Her YouTube channel and Instagram are also super rich in imperative information. She is an author of 8 best-selling books providing healthful, species-appropriate recipes and information on raising and keeping our pets naturally healthy. She has an online store full of amazing natural, holistic, and highly vetted pet products. She is also host to her own Naturally Healthy Pets podcast and creator of the Naturally Healthy Pets Experience, which is a multi-day educational opportunity for pet parents, pet professionals, vet students, and staff to gather and learn from industry professionals speaking on how to care for our pets naturally. And amongst all of this, she still offers very limited consults. If she's not personally available for consult, she has several holistic integrative veterinarians she partners with that can help. So she's absolutely amazing and truly our pet's advocate. She is quite literally a plethora of life-saving information and resources. Thank you again, Dr. Judy, for making all of this available to everyone so that we all may learn and do better for our pets and ourselves.
Thanks.
Can you let everyone know where to find you, your social handles, websites, and all the lovely things?
So the website's naturallyhealthypets.com. You can also get there through drjudymorgan.com. Almost all of our social media is under Dr. Judy Morgan's Naturally Healthy Pets, and we're pretty much on every channel. So whatever floats your boat, whether that's Instagram, Facebook, YouTube, we're there. And our goal, like she said, is really just to empower pet parents. We want dogs to live to their early 20s, and we'd love to see cats living to 30. And we think that is a possibility when we kind of get away from all the chemicals and get back to nature.
I think it's a great possibility as well. If you could sum up your final thoughts on the overuse of medication, chemicals, and pesticides, what would it be?
Educate yourself. Educate yourself on the side effects, the potential issues. Look for natural alternatives. My book, Keeping Your Pets Naturally Healthy, has a lot of alternatives and recipes for different disease problems. We also have a ton of free recipe downloads on the website. So it's really just being empowered by having a better understanding.
Yeah. Educating yourselves. Dr. Judy, thank you so much for being here, for gracing us with your expertise and lending your voice not once, but twice to us on topics that reflect parts of a broken system in the pet industry and in pet health. Thank you for all the work you do, for your honesty, and for educating the world around us. Please never stop being you. I admire your persistence in bringing the dark side to light. From the depths of my soul, thank you for being our pet's advocate.
Thank you.
Thank you for listening to the Holistic Feline and Friends podcast. It is created, hosted, produced, and released with love, and my hope is you learn something along the way. When we know better, we do better. Please share your knowledge and our podcast with others. For more educational content, follow us on your favorite podcast platform, as well as Instagram at The Holistic Feline and online at theholisticfeline.com, where you will also find our blog that includes corresponding posts for each podcast episode with links to all the good stuff. Thank you again. We'll see you in the next episode.
The Holistic Feline and Friends podcast, website, blog, and socials are for informational and educational purposes only. All information, suggestions, recommendations, or comments, whether by written, verbal, audio, or otherwise, either direct, indirect, or association, is not a substitute for professional veterinary care. Please provide your pets with a minimum annual professional veterinary visit, and more often when health concerns arise. The Holistic Feline, Angela Warwick, and all guests and associates are speaking from experience and education. Please continue your research and form your own opinion. This is in no way a means to diagnose.